My name is Chelsea McNamara, and I'm an occupational therapist working in stroke and brain injury rehabilitation with the Early Supported Discharge team in Calgary, Alberta. Today, I'm going to be speaking to you about managing memory impairments after a stroke. The Canadian Stroke Best Practice document reports that memory impairments are common after a stroke. Cognitive challenges affect up to 60% of people after stroke, and all people diagnosed with a stroke should be considered at risk for cognitive impairments. Cognitive deficits can impact daily function and safety, and thus cognitive rehabilitation is a significant component of stroke rehabilitation, and this may include compensation strategy training or cognitive skills training. This short presentation today will provide education on common memory deficits, strategies to support your memory, and treatment activities that you can engage in to optimize your functioning at home. What is memory? Memory is a complex system that involves a variety of interrelated cognitive systems, including attention and executive functioning skills. People often attribute difficulties to memory problems when they're actually impairments to attention, problem solving, or initiation. The severity and type of memory loss varies based on the location of the stroke and the structures that were impacted. There are many different subtypes of memory. However, for the purpose of this short presentation today, it can be helpful to think about memory broadly in terms of memory for what has happened in the past and memory for what needs to happen in the future. In general, you can conceptualize the stages of memory into 4 categories. A breakdown in any of these stages can result in subsequent memory challenges. Step 1, attention. This stage is of critical importance as you must attend to information at the time it's being presented in order to remember it. Internal distractions such as pain, feeling anxious or fatigued, or external distractions such as the television being on in the background, a busy hallway, your partner chatting, a loud coffee shop, etc., can all make focusing your attention at the time information is being presented more difficult, and thus impacting your ability to remember. Step 2, encoding. This is how memories are formed. Your brain analyzes this incoming information that needs to be remembered. Step 3, storage. This is how memories are retained. The information is then transferred to different locations in the brain where they are to be retained. And finally, step 4, retrieval. This is how memories are recalled for their use. Cueing someone to help them retrieve the information can be a helpful strategy if someone's having difficulties with retrieval. Common self-reported difficulties or observed difficulties in people who have memory impairments. Things like, I forget to return books to the library or pay my bills on time. I often forget to buy an item at the grocery store and don't remember until I get back home. I forgot what I wanted to say in the middle of a sentence. I sometimes forget medical appointments or a scheduled time to meet a friend. I sometimes forget if I've taken my medications, particularly if there's been a change. Strategies to support your memory. Broadly speaking, strategies to support your memory can be divided into 2 main categories. Those compensatory or external strategies. So these are strategies and tools you employ outside of the brain. Or remedial, internal memory strategies. These are the tips and the tricks that you use to manage memory inside the brain. However, it is really important to note that awareness of memory challenges is a prerequisite to the ability to utilize either internal or external memory strategies. If you don't believe there's a problem or difficulty, it can be exceptionally hard to generate or employ strategies to help you. We're going to talk more about each of these in the following slides. External compensatory memory strategies have shown strong evidence in the literature in supporting memory impairments. It's important to be consistent when learning these new habits and routines and to be patient as these do take time to learn. It's very important to pay close attention. I can't emphasize this enough. You cannot remember what you don't attend to. Therefore, try your best to minimize distractions, to focus your attention at the time information is being presented, particularly if the information is important, is critical. Writing things down. Making a list before you go shopping or attending a medical appointment. Making a list of passwords, important phone numbers. Making a list of locations where you keep specific things. All can be helpful to help you remember. Using calendars or electronic schedules. So something simple as a calendar in a highly trafficked area of the home, using a day timer, either on your smartphone, such as an iPhone or a tablet, or a paper and pencil day timer to track appointments and events. Staying organized, being consistent, and keeping things routine is very important. So keep things in a consistent place in the house. This isn't the time to reorganize the cupboards. Using alarms and reminders. So setting alarms on your smartphone or even setting an alarm on these different kind of egg timers can be helpful. So setting timers on the oven for when your meal is done. A 30-minute reminder before you need to leave your house to get to work or an appointment. Reminder alarms for important meetings or phone calls. Using checklists. Having a checklist by the door before leaving. Keeping a journal to review at the end of the day. Using a pill organizer or a bubble pack for medications, particularly if there's been a change. Internal memory strategies. So examples of remedial or internal memory strategies can include repetition, repeating the information over to yourself, or making summary statements to ensure understanding. So for example, if you're leaving a medical appointment and the receptionist asks you to rebook for Monday at 3 p.m., you can repeat this information back to them to ensure you understood correctly. And oftentimes they will repeat it back to you one more time. This has given yourself 3 opportunities to help you remember this information. Making mental pictures or mental imagery visualization. So picture the information in your mind. Okay, I'm trying to get to my friend's house. I picture I turn left at the convenience store. Or when trying to remember someone's face, you can try to imagine what they look like in your mind. They have the glasses, or they have wearing a red baseball cap, they have a large mole, something distinct. Making associations or categories, grouping similar things together. It is exceptionally difficult for your brain to remember large amounts of individual or small bits of information. Therefore, the more that you can group similar things together through creating associations and categories, the easier it will be for you to remember. Chunking. This can be helpful, particularly when trying to remember a new set of numbers, like a phone number or an address. So trying to chunk those individual digits into a larger group. Or lastly, creating mnemonics to consciously help you remember information. Strategies for family and friends. Talk slowly. Reduce the length and complexity of information presented at the same time. Allow more time for processing and producing a response. Cue the person to describe the word, idea, or event they're attempting to retrieve, as opposed to just telling them the answer. Repeat the information as necessary. Ask the person to summarize the understanding. Reducing distractions in your environment. And keeping the home organized and routines consistent to decrease the overall cognitive load. 3 takeaways. Memory is a complex system that involves a variety of interrelated cognitive systems, including attention and executive skills, which is frequently impacted post-stroke. The use of remedial and compensatory memory strategies can be helpful in supporting your memory. Remember, be consistent and patient when learning new strategies, as these take time to become ingrained and routine. This concludes the presentation on memory impairments after a stroke. If you have any questions or concerns, please reach out to your family doctor or local healthcare center. You can also check on the best practices links listed on this page. Thanks for listening.